Thank you very much. And thank you for having me to be part of this important forum on overall linkages. My presentation is on Mina over regeneration through acupuncture at Pakungu, which is an area within Mina. Of course, for the record, Mina is the capital of Niger State in Nigeria. The COVID-19 and its effects. We know when this pandemic was announced, it came with a lot of fear, anxiety, and so many far-reaching decisions taken by various governments. And at the end of the day, the pandemic was one of the extraordinary challenges of mankind in the century. And the mayor of Shanyang, during one of the conferences in 2020 or early this year, made a presentation somewhere that it was also a test in governance and leadership, because where there is a weak level of confidence between the leaders and the led, ensuring compliance was always a problem. It has also exposed the deficit in trust and leadership. The COVID-19 exposes so many things, especially in Africa. The weak economy of most African countries was exposed really because you can't keep people from their daily activities for a very long time without having resistance. It also exposes the weak or absence of infrastructure, where our health system was really challenged. We have a very weak surveillance system and so on and so forth. There was also this issue of denial or ignorance of the disease. Many people don't believe that, especially in part of where I am from, whether this pandemic is real or just a kind of creation by certain groups. There is also this issue of poor data. You don't even know how many people are infected, how many died, how many recover, and so on and so forth. There is a class of culture and tradition, which we have to contend with. And very low testing, of course, this is a challenge. How do you test? How many have you tested? And so on and so forth. We have very poor settlement planning system. You are talking about isolation. You are talking about people to be, having given 5-meter space and so on and so forth. In a place where you have more than 5, 6, or even 10 people living in a single room. So completely this issue of distance, is almost entirely impossible. And there is also lack of trust in leadership. So if you look at all of this, one will now will look at COVID-19 like a kind of, in Africa, as a covert pandemic, that you can't predict the depth of the infection, and it provided a kind of good ground for NGOs to support in advocacy and enlightenment. In fact, most of the outlets for people to have information or to know what to do or to have support usually came from NGOs across most parts of Africa. So this project that I want to share here just try to highlight an area in Mina where all these issues of lack of planning is very evident there. And unfortunately, this same area is within Mina, very in the center of the town, but is deprived of almost everything. One, it has drainage issue. There's no drainage to take discharge from houses. There is also no connected pipeline water. And then there is also absence of open space for children to play or recreation and so on and so forth. And it's densely populated. And this area is really prone to disease outbreak because most of the people in this area, because of lack of space and other basic facilities, usually use open dome to put their refuse and also to defecate. This exposes the community to most of these diseases. And when you talk of pandemic, this will be a very veritable ground for it to flourish. And that's why we pick it to see how can we effectively turn around the narrative by using a very simple process of improvement. So we thought of a very simple approach, which we call the urban regeneration through acupuncture at Pakungu, which is to us a solution to urban deprivation, because what you have in this area is a kind of deprivation within the city, but yet is deprived of almost everything. And I believe if you can provide these basic necessities of life to this community, you can turn around so much in the life of these people that will make them feel they are part of this system, they are part of this city, and they are also going to contribute a lot in the development of the city. So the project, as a matter of fact, was inspired by what we saw during the first rural linkages at Sanyong, where the rural part of the country was properly integrated in the economic regeneration plan of the country through inclusive planning. In fact, we were very impressed with what we saw during our site visit to a very rural community in one of the, should I say, hilly area, where they are really living in a rural area, but performing activity that also will give them economic independence and survival, which I believe is something that we can borrow to make sure we change our own area. So the project really was guided by the ongoing Nature State is partnering with UN Habitat through what we call UN Habitat Support Program in Mina, and it was designed to facilitate systematic upgrading of the blighted area of Mina through very simple provisional drainage system, improvement where necessary of stormwater drainage, tarring of the road using minimal cost, so just to make it very cost effective. Because what we saw in Sanyo, you don't have to make it too elaborate, but just make it very, very attractive, and then using the local material, and then provision of public sit-out and children play area, provision of community water point through boreholes, and so on and so forth. These are small improvement that you can do to improve the life of the people. Of course, we thought of installation of solar street light, house numbering, because one of the major challenges that's up to now we are unable to address is even simple numbering. We saw in Sanyong, almost every building, you can identify where it's located, and then you can get to that place by the numbering, and then provision of green area for cooling effect, and also to pick an area where we can maybe look at the potential of investment in that area, and then possible repainting and so on and so forth. If properly implemented, it can bring about a complete turnaround of the area and address most of the challenges. This was our own thinking. And then, like I mentioned, this acupuncture was what we saw being demonstrated during our visit, during the first international conference, where one of the architects, I've forgotten her name, completely captured this idea of very simple approach, systematically addresses contemporary city challenge through small-scale neurologic intervention in city that can have direct impact on the urban morphology and life. This is really what this idea is all about. Pick at any deficiency, improve it, and then you see how the ripple effect will be on the entire system. In this approach, citizens desire to are taken into account in a situational and cultural context that focuses on social cohesion of the urban environment. This was the idea behind this. And like I say, from what we saw during our first international conference, we felt it's very important we look at that. And then what have we done? It involves pinpoint intervention, and then we pick some areas, transportation, recycle, affordable housing, and so on and so forth. We pick the ones that we feel is important within the budget. So the project stages, we look at the site appraisal, discussion, interaction, site enumeration, reporting, presentation, recommendation to the government, implementation, and scale up. Our hope is whatever we're able to achieve, it can be scaled up and replicated in other places. We pick an area, these are the study area. The first one, which is the entire area, we now divide it into two, and then we pick a portion for us to be able to do that. And then this is the area that we pick. And if you look at, we had consultation with the local leaders, with our staff, to be able to get their buy-in. And this is the condition of the area. And that is why I say, if we can improve how this place look like, believe me, it will bring about a change in their life. We measure almost every part. We look at the width of the road, we look at the condition of the road, and then we also discuss with them to look at their needs and demand. At the end of the day, we also identify the roads that we need to improve. If you look at, this is the major road that we're thinking of providing asphalt, and each of these roads, and why we want to put interlocks just to provide like a kind of walkways that will be, stabilized, we drain it by the side. We measure every part of it, and then we costed that to be able to have an idea. And then we also identify 2 locations where we are thinking of providing public facilities that will improve the environment. So if you look at, these are the 3 components that we think by adding the facility will bring about improvement in the area. This is a public toilet that we proposing in one of the areas where they are not dumping rubbish, and this is a clinic that we're proposing for the community, and this is a play area that we are hoping will come along with. Looking at all of this, we measure everything and then provided a kind of estimate how much it will cost, and then make sure we work with the government to be able to fund it. Based on all of this, we have the total number of properties by affected, we have the total length of road, and the total length of interlock to be provided. And based on that, we summarize it here. We have 1.95 kilometers of asphalt road, which will cost about 300 million naira, and then we have 2.9 kilometers of interlock, which will cost 179 million. And then we also calculated the total cost for providing toilet, clinic, and so on and so forth, which will cost 43 million naira. Total costing 523 million. If you take the conversion rate, the total project for us to improve that community will be about $1.2 million, which, if we put that, the life of these people will never be the same again. And we have a kind of perspective. This is how this place look like. And then whatever we think of doing by improving it will go a long way in touching their lives. Their economic, social, and environmental condition will change forever. So what we have in mind is to convince the government that this proposal is made with the firm belief that the project is economically, politically, environmentally beneficial. Economically, by doing it, you are improving this area that will change their economic status, that will make them feel they are part and parcel of the city, and it will have multiplier effect on the economy, not only the area, but the entire state. Politically, also, it will provide the government opportunity to fulfill political campaign promises, and it can change and help the government to achieve a very strategic political goal. Environmentally, providing drainage road and walkway will improve the quality of the environment, improve the sanitation of the area, and ultimately the quality of life of the residents of the area. Of course, this is a very good strategy to also prevent or reduce the possibility of disease outbreak. Socially implementing the project, especially the way the youth of the area accepted us during this project, it could serve as a very good rallying point for the community and open it up. Those will help in reducing negative tendencies of youth restiveness, criminality, and poor environmental conditions. As of now, this area is a little bit infected, let me use that word, by this youth restiveness that can have a very serious consequences. So what is the nexus between water and measures for against future pandemic? Of course, when you provide drainage, toilet facility, opening of road, inclusive participation, open space provision, this all will bring about improvement in the way things are in that area in a manner that will make it very easy to implement preventive measure. If you are thinking of health provision or sensitization, it will be much more easier than if the area is not planned. So this is what we have done so far. Start a press discussion, start enumeration, assessment, implementation is what we're just about to start, and then scale up. This is where we are with the community during one of the meetings in the ministry, just to discuss the implementation. In conclusion, the rate of settlement expansion and encouragement of human activities into new frontiers will always bring man into contact with different organisms. The ability of our health and other emergency surveillance system to identify and prevent future pandemic will depend on an effective planning system that is inclusive and proactive. Unfortunately, most developing countries like ours are affected by poor planning system, poor health sector, and fragile economy, that any future pandemic emergency could be severe, if not catastrophic. It is therefore important we emphasize the need for effective planning so as to know who is where and doing what at any given time. I believe it is by doing so that we'll be able to address the consequences of any future pandemic. Thank you very much for having me. Thank you.